I asked the question, how do phosphorus and potassium intake negatively impact chronic kidney disease? Today, I'm going to be talking about how they impact those suffering with CKD. Chronic kidney disease is one of the leading chronic illnesses in the US, affecting about 15% of the population, or around 37 million people. The function of the kidney is to filter waste and excess fluid from the blood that the body then gets rid of through the urine. Chronic kidney disease is when your kidneys slowly start to lose their function, meaning they are not able to filter waste and fluids, and those will start to build up in your body. There is a way to measure your kidney function called glomerular filtration rate, or GFR. Your doctor can check your GFR rates through a blood test, checking your creatinine levels in combination with your age, gender, and body size levels. The lower your GFR levels are, the lower your kidney function is. There are 4 stages of chronic kidney disease, and each stage is based on what your GFR levels are. Stage 1 has a GFR of 90 milliliters per minute or above. Stage 2 has a GFR of 60 to 89 milliliters per minute. Stage 3 has a GFR of 30 to 59 milliliters per minute, and Stage 4 has a GFR of 15 to 29 milliliters per minute. After that, dialysis or a kidney transplant is necessary to survive. The main causes of chronic kidney disease are obesity, diabetes, high blood pressure, cardiovascular disease, among many others. Once you are diagnosed with chronic kidney disease, you must watch your nutritional intake. What you eat has a big impact on your kidneys, and certain nutrients can be detrimental to your condition, while others can help. There are certain things to avoid when you have chronic kidney disease. Chronic kidney disease is directly correlated to the heart, so directing your diet to support kidney health in addition to heart health is very important. Chronic kidney disease and cardiovascular disease are closely linked with one another, and your heart could be in danger if you are diagnosed with chronic kidney disease. Potassium is a mineral found in food that maintains a normal heartbeat in addition to keeping your muscles working properly. The kidney makes sure that there is a right level of potassium in your body. When the kidneys are not functioning correctly, they cannot maintain proper levels of potassium. Levels of potassium that are too high can cause irregular heartbeat or heart attack. Keeping potassium levels around 3.5 to 5 milligrams per deciliters is a healthy level, so your kidney does not have to work to filter levels of potassium that it cannot handle. Some high potassium foods to avoid are avocados, bananas, black beans, milk, broccoli, carrots, and more. Deborah Clegg and Biff Palmer talk about hyperkalemia, or when potassium levels are higher than 5 milligrams per deciliters in their paper, Treatment of Abnormalities of Potassium Homeostasis in Chronic Kidney Disease. Hyperkalemia is commonly associated with chronic kidney disease and cardiovascular disease. Because potassium levels are too high with hyperkalemia, your heart is not able to function at normal levels, and it could potentially lead to heart attack or death. Phosphorus is another nutrient that you should limit intake of because your kidneys cannot handle filtering it from your body. Phosphorus is important for maintaining bone health, but when phosphorus levels are too high, it could be potentially dangerous. High levels of phosphorus can draw calcium out of your bones, making them weak. Because that leads to both high calcium levels and phosphorus levels, it can lead to dangerous calcium deposits in the blood vessels, eyes, lungs, and heart. In the long term, this can lead to heart attack, stroke, or death. Healthy levels of phosphorus is between 2.5 to 4.5 milligrams per deciliters. In addition to potassium and phosphorus, limiting protein in your diet can help slow the deterioration of kidney function. Protein takes the most energy to digest, and therefore the kidney has to work harder to filter out the byproducts of protein. If not filtered properly, more byproducts will end up in the blood instead of being excreted through the urine. Avoiding foods that are high in protein and saturated fat like red meat, eggs, or milk is important for kidney function, and opting for protein like fish or poultry will ultimately be more beneficial for your health. To recap everything, it is recommended that those suffering with chronic kidney disease limit potassium intake to less than 2,000 milligrams per day and limit phosphorus intake to less than 800 to 1,000 milligrams per day. Even small changes to your diet can help, like using olive oil over other oils which contain healthy fats and is phosphorus free, and replacing many whole grains that are high in phosphorus with grains like buckwheat or wild rice. Reese, Franchik, and Broska talk about potential benefits of a vegetarian diet and chronic kidney disease in their paper, Vegetarian Diet in Chronic Kidney Disease, Friend or Foe, and they say a well-planned vegetarian diet is associated with cardiovascular benefits and the correction of CKD accompanying complications because of lower phosphorus and protein levels. Additionally, patients trying to decrease potassium levels should avoid tofu or seitan and opt for lower potassium options like nuts or soybeans. Thank you for listening to my presentation.